In part one of an in-depth interview with Hudson County View, CarePoint Executive Peter Kelly, the former CEO of Christ Hospital, explains the brief history of the growing healthcare network.
The CarePoint health system had its origin really back in 2007, 2008, when Bayonne Medical Center went into bankruptcy. And at that time it went into bankruptcy because it was, it had poor contracts with insurers. The cost of providing care far exceeded the reimbursement that they were getting, which is not uncommon with many urban hospitals in this area today. And they were forced to file for bankruptcy because, again, the reimbursement they were getting simply did not match up with the cost of care. At that time, the owners of the CarePoint system purchased Bayonne out of bankruptcy. They, by more business-like efficient management, managed to cut the cost of the administrative cost of providing care there. And they took a very hard line with the commercial insurance companies. And that was, if we can't have a fair contract with you, we don't want a contract because it doesn't make any sense for us to sign a contract where we're going to lose money on every one of your patients that's admitted. And the biggest insurer in the state, Horizon Blue Cross Blue Shield, actually went into court to sue over that, and they lost and we won. And as a result of that, we have a very fair contract financially with Horizon. And that really helped stabilize the financial condition of Bayonne Medical Center. In 2011, Hoboken University Medical Center, which at the time was a quasi-municipal hospital at the time, also ran into financial problems, was about to file for bankruptcy, and they were purchased by the same owners. And then in 2012, because I was the CEO of Christ Hospital at the time, we filed for bankruptcy also, and through what's called a 363 sale and bankruptcy and auction, we actually decided to go with CarePoint because of the bid that they made. So by 2012, there were 3 hospitals, all of which were failing because of the financial crisis that's hitting most urban hospitals. So remember, 26 hospitals in New Jersey have closed since 1992. The owners of CarePoint formed the system, again, through much more efficient management efficiencies, which not-for-profit hospitals aren't always noted for. We're able to cut the cost of the administrative overhead, and at the same time, we're able to have enough of a critical mass to take on the commercial insurers. Now remember, commercial insurance is only about 5% of the patients we treat, maybe 6% at most. But in all of those cases, we had contracts that we would lose enormous amounts of money on admission. So we sat down and took a very hard line and said, we will negotiate a contract, but it must be fair, and it must be one that is not only good for the insurers, who for years have just taken advantage of their leverage with these smaller urban hospitals, or will simply be out of network. And when patients come into our hospital, New Jersey's law says that the insurance company must pay the charges of the hospital, and we're very transparent about that. So, are the insurance companies paying more that we don't have contracts with? Yes. Are we open and in some cases negotiating so we could get a fair contract? The answer is yes. Does it cost the patient any more? The answer is no.
Kelly followed up by explaining the purpose of CarePoint's out-of-network model and what it means to patients.
If you have a insurer and your insurer does not have a contract with our hospitals, which means that we have agreed to terms of pricing, so that we know what we're going to charge, and we know what you're going to pay, and we've agreed on what that payment's going to be. We would sign a contract, you'd be in network, and you would have no concerns. Being out of network, when a patient comes into the emergency room, if we don't have a contract with your insurer, then New Jersey state law says that the insurer has to pay the charges of the hospital they're in, not the patient, the insurance company. So what happens is, yes, the insurance company will get a much larger bill than they would if they had a contract with us. And frankly, it's the only leverage that we have to bring them to the table. You know, if they wanted to come to the table, we could sign contracts tomorrow, and I'm sure we could work out fair contracts with all the insurers. They would rather pay our hospitals a very large amount of money because they're worried if they sign a fair contract with us, all of the other hospitals in the state who they have unfair contracts with, you know, are going to line up and want it too, and all of a sudden, you know, their profits are going to be hurt. I mean, the CarePoint system is not going to put a dent in the Aetnas and the Horizons and the other commercial insurers of the world. They're just not going to do that. But what it means for the patient, to get back to your question, is that you as a patient would only be obligated to pay whatever your contract with your insurer says you're going to pay. Whatever your deductible and copay are, that's all you're required to pay. The hospital is required to do a balanced billing, meaning that the difference between what your insurance company pays and what we charge the insurance company, we have to send you a bill for that. That's a state law. But that doesn't mean we have to collect on the bill. But the insurance companies will, you know, very much use that to make this big splash out there, implying that patients are paying these exorbitant amounts. That patients are not paying it. The insurance companies are paying it. And again, we're very transparent about this because, you know, we're taking the money, the surpluses we have, that's how we're paying for providing primary care for uninsured patients. That's how we're providing the medications. That's how we're providing the specialty care. Somebody's got to pay for that. And we make no bones about the fact that, you know, in urban areas, you know, we have a very small population of insured patients and very poor contracts with the commercially insured patients. If you go to urban areas where you have these larger hospitals who have a very small Medicare and Medicaid population, they have much more attractive contracts with the commercial insurers than we do because they're larger and they can negotiate them. So we're just in a position where we said we need to level the playing field here. We need to make sure that we're in a position that we're not losing money on a very small part of the population we serve. But again, patients have to understand that it does not have a negative impact on their on what they will have to pay if they're hospitalized in one of our hospitals.
I'm Michael Shuren with Hudson County View, the eye of the community.